Hi, I'm Dr. Lydia Sosenko, provider of oral appliance therapy for the treatment of snoring and apnea. I love my patients to be more successful with their oral appliances. So today I'm going to be covering part two, the weekly or deeply cleaning of an oral appliance. Now the dental appliances we're talking about today are not the self-made, boil and bite. These are the professional oral appliances. Some are have straps, tubes, some are two independent pieces, but there's over 100 different devices on the market. So those are the ones we're talking about. Now, if you missed part one, that one covered the daily basic. That's about valid for just about all the 100 devices that are in the market. This type, part two, covers more of a weekly type cleaning, a deeper cleaning, that not all devices actually need or of benefit. Some devices might look identical and will only require part one type cleaning. Others, if you have been suggested that it's okay to drop in like a denture type cleaner or a cleaner of some sort on a once a week type of basis, or anything like that, if that's ever been mentioned to you, then part two is definitely going to be of help for you. And always check with your dental provider that gave you the oral appliance, because there are so many different types, and even within the same type there might be different substructures. So please always check with your dentist. So let's get started. So first you have to pick and choose a cleaner, and I will be reviewing the most common recommended of the cleaners that most dentists do recommend. There will be links to all of these products in that resource guide. So first of all, a retainer bright is a common one that is available through Amazon and other online sources and some pharmacies. Some tabs often come as samples with the Somnodent devices, and this is available through their website, and that's a possibility. Now, you can also use Effordent, Polydent, and other similar tablets that are available readily at pharmacies, and they're usually made for dentures or partial dentures, and there's a variety of names of those. Also, as mentioned in the last video, that many devices are okay with using this daily as well, and that's Dr. Berlin's Cleanodent crystal products. And this is very mild, but also very effective in killing the majority of bacteria, and kills Candida, strep, E. coli, staph. So it's a little bit more effective in killing these bacteria, more so than the Effordent type, yet there's gentle to use daily and in a weekly. It also does have a small travel size pump that's very convenient. Okay, once you have a cleaner in mind, you do want to use it, and you submerge your device, and then you either use the tablets. Make sure your containers are deep enough to submerge. So some people like to use a different case for their weekly cleaning. Sometimes they'll use the same case, but you would go ahead and drop in whatever tablet you're using. Alternately, if you are using the Dr. Berlin's liquid pump, then you would squirt 4 pumps into that same water that it has your submerged device. Now, some of these boxes might say to have it submerged longer than 10 minutes. I just think 10 minutes is a good general number that most dentists and laboratories are fine with. So definitely do not overnight soak or anything like that. So after 10 minutes, take it out. You would take your device. I would use that soft toothbrush or a soft denture brush and get into all the nooks and crannies of your device. And then when you're done with, all sides, including any mechanism, you're going to rinse it out really well. And then you would either store it where it can air dry. You want to shake off the excess. After it's been cleaned, you can store it either dry, air dry it, or submerged, depending on the original instructions given to you. And that would be the same for the daily cleaning. So if it's in clean water, after it's been cleaned, you put the device inside, you cover up that container, and then it is submerged now. We did talk about this in the last video, and the air dry versus submerge really does depend on the manufacturer and the type of device, and it is tricky. You really should ask your dentist depending on which device you have. You might have two identical looking devices made from two different labs with two different substructures, and one they recommend to submerge it and one air dry it. One might have just the basic daily cleaning, and then the other one might have the daily and the weekly cleaning. So just remember, please, to ask your provider. So lastly, let's talk about ultrasonic personal home units. There are some laboratories that really don't want you to use this on any of their devices, and there's definitely some that are okay with weekly using these personal units. I have only used the Dr. Berlin's home unit. This unit has 3 suction cups on the bottom, preventing it from moving around on your counter. So it makes it very sturdy. It has on the bottom, it has a battery compartment, and then on the back is the on-off switch. So when you use this, you would submerge your device in the compartment that it provides. Now, some units might not be removable, some are. And then you would put in the tablet or the pumps of the device, whichever you're using. You could use either or. You would cover the lid and then let it run for 10 minutes. Again, most manufacturers would really want you not to have it soaking any longer than 10 minutes if they are okay with these types of cleaners. You would clean the device with your toothbrush again, just like before demonstrated, and then either air dry it or submerged in water, depending on your device. So I definitely don't recommend toothpaste. There's just too many variety and they might be too abrasive for your devices. Do not submerge your device in mouthwash. You can rinse out, but don't have your device soak in it. And avoid baking soda, vinegar, hydrogen peroxide, bleach, and use only soft types of brushes, whether they're regular toothbrushes or denture type, anything that can help you get into the nooks and crannies. One extra tip is don't forget to clean the containers. They can harbor bacteria, they can get pretty neglected over time. So, definitely periodically, even if it's weekly, go in there, clean it very well, use a paper towel to dry it, a towel. Some are dishwasher friendly, some of these containers. I'll try to put those onto the resource link in the video description of which that I found to be dishwasher friendly. But that's a very important also tip is don't forget to clean the containers. And lastly, make sure you make it to those annual visits to your sleep apnea dentist. It is strongly recommended, especially to help prevent side effects of bite changes that can occur, and if they're caught early, can often be reversed. But the sleep dentist will also check your device for integrity. If they feel that there's staining or buildup on there, they may put it in the ultrasonic professional cleaning unit with some specialized cleaning fluid to help remove that debris. So that's it on how to clean your oral appliance on a weekly deeper level. Make sure you talk to your dentist to see if these instructions will be helpful and valid for your device. If you've missed the first video, you might want to look at the basic video if you think it might be of help. And then one next blog or video will include all the links that are mentioned in today's video and the last one, and some more actually products. And that we're going to cover replacement and cleaning products for sleep apnea oral appliances. Over time, people just don't know where to get the elastics or different cases. Some that might be better for travel suited or deeper for weekly cleaning and things like that, as well as the solutions. So I'll be all on a link guide or a series of links on that blog. So you might want to keep an eye out for that. If you found today's video helpful in any way, make sure you give me a thumbs up and feel free to reach out, or if you have any questions, put them in the description and I will try to answer them on a different video. Thank you so much for visiting.